Joining me now is Brian Gragnolati. He's the president and CEO of the Atlantic Health System and the immediate past chair of the Board of Trustees for the American Hospital Association. Brian, I just want you to pick up where Lippy Roy left off about this shortage of crucial medication. In fact, there's medication tied to the fact that people are in ICU on ventilators, and that hasn't been discussed all that much, that there's a potential shortage there as well.
Yes, thank you, Ali, for having us here and having this important conversation. The notion of the canary in the coal mine is one that I think about, and northern New Jersey is one train stop out of the city. So we are in that complete zone. In terms of thinking forward, this issue on medications is critically important. And this week, we escalated that through the American Hospital Association with our partners at AMA and other organizations to try to say to the federal government, you need to really address this issue and you need to do it now. You've got to allow drug companies to be able to manufacture these kinds of things. But at the same time, we need to make sure that they can do it and that they're willing to do it. And that is going to be critically important. The physician that was just describing the impact of not having these critical medications on ventilated patients is startling and in some ways inhumane. And we have to focus on that issue as an emerging one. And thank you for bringing that up.
You've described not dealing with this medication issue as performing surgery without anesthetic. What's the impediment to being able to either produce or import the necessary medication to deal with all of the Americans who are going to be on respirators or in intensive care for treatment of their coronavirus symptoms?
There are regulations that are in place that limit the production of particularly things that are sedatives or paralytics. And that was put in place for obvious other reasons. But we have had shortages before this pandemic occurred. And we've been working on that. But the other thing that this pandemic has done is it's just taken that situation over the top, because we have and will continue to have more ventilators in use in this country at one time than we've ever had. And because of that, it just exacerbates the problem. So the government has the ability to turn back some of that regulation and allow those production levels to go up. And what we need to do is to make sure that the drug companies have the raw materials and the impetus to move forward on this very, very quickly.
Brian Gragnolati, thank you for joining me. Brian Gragnolati is the president and CEO of the Atlantic Health System.